So we'll start with the really basics of the menopause. It is diagnosed when you've had 12 months without any periods over the age of 45. If you don't have a uterus, because you've had a hysterectomy, for example, then it's with the symptoms of the menopause over the age of 45. The average age is about 51 years to go through the menopause. And there are different ways it can occur. So it can be naturally, and I'll talk about that in a minute, or it can be surgically, for example, having surgery to remove the ovaries, or it can be medical. And this includes having gone through things like chemotherapy, radiotherapy, or having injections to switch the ovaries off. So all these things can drop your estrogen levels and give you give you the menopausal symptoms as well. The perimenopause is slightly different, and that can occur much younger, so it can be in the 40s or even younger. And that's essentially when you have the symptoms of the menopause, but you're still having periods. They might not be very often, they might be quite irregular, they might be quite heavy, but you're still having occasional periods. So you haven't had that 12 months, but you're struggling with the hot sweats and symptoms similar to that. So that's the perimenopause. But then you've got early menopause, and that has a few implications for health, but that's when the menopause occurs under the age of 45. And then you've got premature ovarian insufficiency. So it used to be called premature ovarian failure. And that is when that's under the age of 40. So that can be in 20s, 30s, and even in teenage years. So that's when you start periods, and then they stop much earlier than 40 years old. And this is important that it's managed correctly because of the long-term implications of having no hormones as a young lady. And we'll touch on that later as well. So I think menopause should be considered more of a transition rather than a disease or something that we shouldn't talk about. It's important to talk about it, and the reason it's important is now that women are living longer. Many women are spending up to half or over half their life in the menopause. So it's important that we research it. We have good treatments. We understand the benefits of treatment and the risks. But also, really importantly, it's a really good opportunity to sort of look at health in general. So if you're going to spend half your life in the menopause, how can you have a healthy life? How can you be free of disease in that part of your life? And that's where I think, at the menopause, thinking about your diet, blood pressure, cholesterol, risk of diabetes, ensuring that you're getting the breast screening mammograms, ensuring you've had your cervical smear tests and they're up to date, and ultrasounds if necessary, and just making sure that you've reduced your risk of becoming unwell later in life. So why does it happen? These grey blobs are meant to represent the ovaries, and within the ovaries, these little darker blobs are the eggs. So at birth, they're in the womb. You have the female fetus has millions of eggs, and then they're born, and they lose quite a few of these eggs. And then as they grow up in their sort of younger years, they lose more eggs without having menstrual cycles. And then by puberty, they've got about 300,000-400,000 eggs in the ovaries. Now, when puberty starts, when the periods start, what happens in a period is a group of these eggs is recruited by the body. So the brain produces a hormone called FSH, and that's follicle stimulating hormone. And it asks the ovaries to make an egg, because the eggs make estrogen, and estrogen makes the body healthy and helps with the blood pressure, it helps with the skin, it helps with lots of things. So the body is saying to the ovaries, please, can you make an egg so we can have some estrogen? So the ovaries go, okay, well, here's a group of eggs, and of those eggs that are sort of recruited, as we call it, one of them becomes the dominant egg. And this egg makes lots of estrogen and it ovulates. Now, if that egg that's released doesn't fertilize and become a pregnancy, what happens is the period comes and then another cycle happens. So every time these there is a period or a cycle, there is a group of eggs lost. So as the lady gets into their 40s, the majority of these eggs have been lost. Now, the first thing that happens is the perimenopause. So there's still eggs in the ovaries, but there might only be a few hundred or a few thousand. And the brain is asking, it's sending this hormone FSH to the ovaries and saying, please give me an egg, I need some estrogen. And the ovaries are saying, well, I can't find one at the moment, but I will in a bit. So what happens is the periods become quite irregular because the body isn't giving up an egg. The ovaries aren't giving up an egg on a regular basis. So the perimenopause, you have these irregular periods. It's because the body is looking for this egg and it can't find it. But occasionally it will find an egg, and that egg will develop, and the menopausal symptoms you might find get better, and you might find your hot flushes have gone for a few weeks. And then you have a period and the hot flushes come back because another egg hasn't followed on behind it. And that's the perimenopause. And then eventually the ovaries do run out of eggs, and the body's making so much of this FSH hormone, you can test it in the blood and it's high, but there's no eggs made, so there's no estrogen. And that's when the menopause happens. The periods stop and the symptoms persist.